Dr. Jason Richey, one of the medical directors for Northport Health Systems. I've been asked today to talk about COVID-19, the impact of COVID-19, and the vaccine to combat this horrible illness. According to the CDC statistics for the United States, there have been 20.6 million cases of COVID-19 reported for the nation. Out of this, there have been 351,000 deaths in America. COVID-19 symptoms may appear 2 to 14 days after exposure to the virus. These include fever, cough, shortness of breath, muscle aches, nausea, vomiting, and diarrhea. Emergency warning signs for COVID-19 include trouble breathing, pressure in the chest, new confusion, and bluish lips or face. Symptoms may vary in occurrence and intensity based on the person's chronic medical condition and age. How can we combat this illness? It is important that we practice proper social distancing, mask wearing, and hand washing. And now we have the COVID-19 vaccine to help us battle this illness. In order to help the COVID-19 vaccine become available quicker, the research and production of the vaccine have occurred simultaneously. While this is different than vaccines in the past, the CDC has taken many measures to ensure that the vaccine is safe. It was first tested through clinical trials, then on a few volunteers, then hundreds of volunteers, then tens of thousands of volunteers before releasing the vaccine to the public. It was approved based on its showing minimal side effects in the volunteers as well as extensive safety qualifications it met. Vaccines work with your immune system, so your body will be ready to fight the virus if you're exposed. This allows our bodies to develop an immunity to the virus without our bodies actually getting the illness. The vaccine gives the body a set of memory cells that will help it recognize the virus in the future and remember how to fight it off. The vaccine has been shown to be 94% effective in preventing infections. As with any vaccine, there are a few common side effects reported, including pain and swelling at site of shot, fever, chills, tiredness, and headache. If you develop these side effects, drink plenty of fluids, apply a cool washcloth over area where shot was given, and exercise the arm that the shot was given in. Contact a doctor if the redness or tenderness increases after 24 hours, or your side effects do not go away after a few days. The COVID-19 vaccine is administered in a series of 2 shots that occur 28 days apart. It takes your body time to build immunity provided by the vaccine, so the vaccine may not protect you from COVID-19 until a week or 2 after your second shot. The COVID-19 vaccine will be made available to people based on a priority ranking system created by the CDC. This means that healthcare workers and long-term care residents and employees will receive the vaccine first. If you are watching this video, then you either work with or know someone who is in a long-term care facility or is at high risk individual. Nearly half of all COVID deaths reported are nursing home residents. As shown in the chart, COVID-19 death rates drastically increase with age, so it is essential that we take extra precautions in order to protect our elderly population. This underscores the importance of you taking initiative and getting your COVID vaccine. If we can eradicate this illness, we can get back to doing what we do best, and that is taking care of those who need us the most.